Good afternoon. My name is Vera Yan, a third-year UCLA student majoring in biochemistry, and I am the director of today's panel discussion on opportunities and growth strategies in healthcare. Please allow me to introduce you to our distinguished speakers. Dr. Eric Avanis Agjani, the Vice President of Premix Clinical Laboratories.
Thank you.
And also Ms. Linda Bai, the Executive Vice President of UCare Pharmaceutical Group. This panel will be moderated by Dr. Irong Yu Levy. Dr. Irong Levy is the CEO of Emerging Transformational Ventures, based in Los Angeles, and CEO of Asia Strategic Growth Enterprises, based in Hong Kong. The firms engage in strategic mergers and acquisitions, financial restructuring, and U.S.-Asia ventures partnerships. Portfolio and expertise include biotechnology, medical laboratory, communications technologies, manufacturing, media, entertainment, and real estate. A turnaround CEO, an innovative technologist, and a published author with global operational experience, Dr. Levy led as CEO, chairman, and director of several publicly traded and privately held companies ranging from early stage to multi-million-dollar global firms. His experience working in Asia since 1995 includes business operation in Hong Kong, research and development in Taiwan, electronic purchasing and manufacturing in mainland China and Thailand. Dr. Levy has been working closely with Premix Laboratories for the last couple of years. Let's please welcome our moderator and panelists for the panel.
Thank you, Vera. It's my pleasure to moderate this panel of distinguished speakers, and I'll introduce their bio. I want to ask quickly, how many people are here from the healthcare industry? Good. How many people care about the healthcare industry? Good, that's good. I'll introduce Lin Bai. His work in the pharmaceutical industry for 13 years. She has been involved in operations since the inception of UCare and has a familiarity with all departments of the entire company. She also serves as general manager of UCare Pharmaceutical Trade Company Ltd. Bai is primarily responsible for the company's international business, oversees mergers and acquisitions, business development, capital operation, and strategic management. She was a general manager of Nigeria branch company of UCare and led the successful purchase of a branch factory of Actavis in California. Bai has a master's degree in finance and is a licensed pharmacist. She's currently pursuing an executive MBA program with the Guangzhou School of Management, Peking University, and Kellogg School of Management. Thank you. Dr. Eric Avanti Arajani graduated with a PhD in molecular biology from this university at UCLA in 1995. Subsequently, he was offered the directorship position for UCLA's sequencing and genotyping facility, which he oversaw for 4 years. In 1999, he founded his own sequencing and genotype facility, Laragen Incorporated, and also started consultation for clinical laboratories in Southern California for setting up clinical molecular tests. Avanis Agjani joined Premix Clinical Laboratories Incorporated as a partner in 2004 and has been serving as the Vice President of Premix for the last 11 years. Premix Clinical Laboratories is currently the largest independently owned clinical laboratories in California with over 200 employees and over 40 patient service centers. He has multiple publications and has been instrumental in development of unique tests such as NP screen, and he'll talk more about that, a molecular test for nasopharyngeal carcinosoma, which is prevalent in southern China and Southeast Asia, and is currently involved in a large clinical trial in the field of pharmacogenomics. According to the Ministry of Health in China, the country will generate healthcare opportunities over 500 billion in 2015. Along the rest of the economy in China, healthcare life sciences market has grown dramatically, now accounting for 5.6% of the global market. Looking forward, we assume that there will be 18 to 20% annual growth in Chinese drug spending throughout 2015, according to KPMG. We're going to start by asking the panelists just a general question for them to speak about their experience and observation on the healthcare both in the US and China. So based on your observation, dear members, what are some of the key trends in healthcare sector given the changes and transformation of the sector in both China and the US?
If you don't mind, I'll take it. So, I would like to first thank everyone that's here. It's a fantastic group, and I like the interest. Very impressive. It's going to be an interesting 10 years, I guess, in the next, in the future, with the collaborations and things that are going on right now between the two countries, as we can see. Both countries have large populations. Comparatively, I guess the United States is not in comparison with China, but still is dealing with a large and aging population, I should say. That's an issue. And so based on that, both countries are faced with the dilemma of having enough physicians to handle the work. So we can see this trend going on that there's a push towards having physician's assistants and nurses and pharmacists actually try to take the primary care burden and leave the physicians for a little bit more serious or secondary work. And this is a trend that we can see here. I'm not, very much familiar with China, but I can hear that there seems to be a shortage, especially in the rural areas with the hospitals, of not having specialists around, and even for regular work, there seems to be a shortage of physicians. So there seems to be that trend to educate the nurses and physicians' assistants as a primary line of defense for the aging population and the growing population. That's one of the trends that I'm seeing. The second thing is, I guess both countries are moving towards more prevention. And so if you have more preventive measures and better health, then you have less interactions at the hospital and the physician level. So that's what you want to avoid, because that's when things get costly. And they're trying to, the trend exists, I think, in all the countries with aging population, to push people to be more cognizant of their health. And we can see this movement with different types of, for example, software and the new technology, like for example, the Apple Watch is coming out pretty soon, and it will be checking for your heart rate, reminding you to do certain exercises, keeping track of what you eat, and so on and so forth. And that seems to be a trend picking up in the middle-aged group, so that they're more cognizant of their health. The other thing that we can see is that the governments are pushing towards more personal care in the rural areas. For example, you can see that there's a collection devices that are now being approved by, for example, FDA here, so that people can take samples and send it through mail to laboratories, as opposed to making a clinic visit so that they can get tested. This has been proven. CDC has just, for example, done a test here of even taking cervical samples for regular pap smears and HPV screening for women's health. and that seems to be, proving to be very helpful and cutting down in a dramatic way, I guess, when it gets popularized, so that the office visits and physician interaction and hospital visits are minimized. And if you have a robust screening across, the population, then what happens is that you have a healthier population in general and faster interventions. So you don't get, for example, cancer and the entities have to deal with, chemotherapy and moving towards cancer. If you can prevent it up front with these kind of tests and across-the-board screening, that can be very helpful. We can also see a trend that is going on, at least in the United States, with software companies trying to come up with parameters for physicians. And those parameters are, for example, there are softwares that are keeping track of a physician's performance, like how is their patient population doing on their hemoglobin A1C or glucose, for example, to see if their diabetes is controlled well, or how's their LDL being affected, for the bad cholesterol levels being affected. And so they keep a trend of their patients, and that is being reported to the for example, Medicare, so that is going to affect a physician's performance and in the future the payment. So there's this kind of software and hardware, if you will, coming up in the industry, so this to have this preventive effect, so we don't have the interactions when we reach of older age. At least this is what I'm seeing in the market currently.
No matter the American market or the China market, the market is growing with the aging people. It grows very fast. And no matter in America, we know the Obamacare, and in China, we also have some new Medicare insurance, also enlarge the coverage of the population. So the medical, the needs will still in the fast growth way. Yeah, so that's why we still focus on how to supply the more medical need for population. So I think the key trend, no matter in America or in China, and the focus on how to supply the more the more demands for them. And in China, if we think about the healthcare sector, maybe not only the pharmaceutical, also the health food, and the more people focus on their own health condition, and now we already have more new devices to collect more information, just like I mentioned, the iWatch or something, so you can get more information about yourself. So sometimes you can do something by yourself to choose the health food. So in the long run, I think not only the pharmaceutical product, but also the health food, and also the related medical devices still in the very fast growth path. Okay, thank you.
With regard to the increased awareness of the need for higher quality care, can you make a comment about that? The awareness, the increased awareness in China for quality care. What do you see in the population, the awareness in the population for that?
Sorry, I don't.
The awareness of people more aware that they need higher quality care, moving into urbanized, moving more into the cities. How do you see the effect of that awareness affecting healthcare?
Yeah, sure. I think the problem mainly because the balance of the resources, of the hospital resources. Almost the biggest hospitals and the best doctors, they in the big cities, Shanghai, Beijing, Guangzhou. So if someone want to get the good healthcare service, they choose go to Guangzhou, Beijing, or Shanghai. Even they live far away, the very small cities. Yeah, and in now and at present in China, the hospitals still have the most income from the pharmaceutical products, not only from the medical service. So it's the same condition in most of the biggest cities. They have the best doctors, best drugs. So more people want, they even cost much. They want the choice by air, by train for a long time to get the medical help. Yeah.
And the government has made commitment in 2009 with a new program in healthcare. Can you expand on that?
Sorry,
the government in China made a commitment in 2009. It's called the 12-step program for the next 5 years to be committed to healthcare overall. So you have a lot of that. So healthcare in general, the whole meaning of the word healthcare and the growth in healthcare in China includes pharmaceuticals, medical devices, distribution, hospitals, pharmacies, and of course insurance. So you have it on all sectors when I talk about the fast growth in that, okay? What are some of the identified risks with healthcare business development across the US and China? How can these risks be mitigated, Eric?
I think the main issue is regulations. I think regulation is the main problem. So for companies from China coming to United States, they have to meet the demands of at many different levels. Primarily with FDA, then if they want to get into the healthcare at a service level, there is the state regulations, then the federal regulations, and in general, unfamiliarity with these regulations is, I think, what this hindrance is. I believe the same is U.S. companies going to China, dealing with the regulations there, being able to penetrate the market correctly. And so I think the best way that I can see this can be mitigated is either side, if Chinese companies are coming to the United States or American companies are going to China, is to have a partial ownership of a company, of an existing company in either country. So let's say a company is coming from China, wants to penetrate the market here. I think the best way would be to go ahead and to partially purchase shares in a well-established company that has already knows all the rules, is established, is already selling, doing business in the United States. So that in that manner, a co-ownership, I believe, would work best. In either case, same would be true when a company from United States goes to China. I think if you are in bed with a company that knows the ins and outs, knows the relationships, knows the rules of how to play the game in either country, that's how to mitigate it and get around the regulation problems.
So according to Thomson Reuters, as mentioned also in the pamphlet that you received, healthcare M&A activity in China rose to a record of 18.5 billion in 2014. So there's a lot of activity in the M&A area. So with new biotech acquisition, increase in stakeholders, value globalizing a biopharma market, as well as changes in the government regulation, as you said, both China and the US, what does the future hold for life sciences in general as an industry?
You want to take that? Or? I think things are moving along, and I think in both countries, I'm going to give you an example. One of the examples is a company by the name of BGI. BGI is a Chinese company that has started a very large gene sequencing center in China. And they also have a very good relationship here with, I believe it's Princeton, City of Hope. They have very good relationships with the European genome centers. So they have gone in and they've put multiple instrumentation there, I believe to the tune of about 250 instruments, and they are increasing their genome database by leaps and folds that we do not have that in the United States. Although they're getting the technology from here right now, they're buying their sequencers from Illumina. And they're also starting to, I believe they just acquired a company here in California that has a new sequencing technology. So they're setting this up, and I think that's where the future is. So I believe this company has the vision of having the database for the largest human genome, nuances in China, and then allowing the world, or actually selling it to the world, so that people can get in there and try to do their research, find out. The pharmaceutical companies can go in and see, what are the different variances, if people have been on certain drugs, and so on and so forth. So I think this is where the future is. This kind of innovation that comes from a company walks in there boldly, takes on the world, and where they didn't have the technology or anything like that to start it. And what my understanding is right now that they're running short of is experts and pathologists and geneticists to actually sit down and sift through the data and come out with a meaningful user-friendly interface, so that clients around the world, physicians, pharmaceutical companies, hospitals, geneticists, and researchers can use. So I think that's where it's at, and it can go both ways.
Mm-hmm. Good. Linda Bai, as the general manager of Eurocare Nigeria branch and the leader of the U.S. branch factory purchase, you clearly work with the globalization team on a daily basis. Did you encounter any barriers and challenges during the cross-cultural, multinational management? If so, how does Eurocare address these issues, and recommendations do you have for other companies?
Yeah, for the cross-national management, I think the main problem may be the management culture. Because in different countries, the culture is different, and how to combine the advantage of the different culture and how to find a same target for your team, for our same future is very, very important. Mm-hmm. Yeah, and when we go to the African market, at first we think maybe we can control the cost when we organize the assembling manufacture there. But after that, we find maybe the easy way is just to export product directly to America. To Africa. Even we can get lower cost there, but the manager cost and also the and also organize the regulation with the government still very, very, very high cost. But for America, we choose to buy a facility here and to set up our team for the future. What we know is still have many culture combinations and still have many barriers for the future. But America is still the largest, biggest free pricing pharmaceutical market. And the uniform, and the market is unified, goes through the American market, right? Mm-hmm. And this is different with China. In China, maybe different provinces have different tender for pharmaceutical product. Mm-hmm. Yeah. So I think when we think about the management across the nationals, the communication and set up a same target for your team to control the risk of the cultures.
Mm-hmm. Eric, as an experienced clinical research, can you briefly comment on the applicability of the latest leading test technology, e.g. molecular test in China, such as application of MB screening, the one that will discuss, facilitate the treatment for nasopharyngeal carcinoma.
So. Let me tell you the story about this, which is interesting. About 10 years ago, a group of Chinese physicians, actually from Canada, approached us and asked us to develop a test, a screening test, for a cancer that is prevalent in southern China and Southeast Asia. At the time, I had no clue about it. I hadn't heard about it at all. So it was interesting that they saw this need. So I started working on it, and we developed the test. And the good thing about it is that this physicians told me that if you catch this cancer early, it's one of the cancers that can be cured by, if you stage 1, about 90–95% of the time, very simply by just radiation. But the problem is that the cancer is located in such a place that it is difficult to see. And so once the patient is aware of it, suddenly they start seeing, for example, nosebleeds, ear bleeds, pain behind the eyes or something. That's already too late because the cancer is already at stage 4. So you wanted something to be able to test and catch the cancer early. So we started working on this thing, and it actually worked. There was a collaboration with some hospitals in Hong Kong and some physicians from Hong Kong that were generous enough to send us samples. So we were able to come up with a test that is about very, very high accuracy, about 99% accuracy, using real-time PCR technology, which is not very, right now it's not very high-tech. Maybe 10 years ago it was, but not right now. But is now prevalent enough so that it can be used all over the place. So it is fulfilling a need, I think, that makes these things happen. There's a need for this thing. There's a high prevalence of a cancer that, if you talk to even a physician in the United States, they might not be familiar with it because they don't have patients from Southeast Asia or southern China. If they're not dealing with these populations, they will not see it. But if you go to any, that's my understanding. I have not done this personally, but this is what my collaborators are telling me. So if you go to any rural area in southern China and ask them about this cancer, they would know about it. So because it's so prevalent and someone in their family has been affected by it. So there's a need, and there's the technology, and it's pretty simple, and it can be used, and it can start saving lives. So we at Primex right now are getting samples coming in from Hong Kong, and what we're looking into is trying to take this into China and market it there. And my understanding is that the government should be pretty interested in it because it's a simple screening test. You do it once a year, and the result can be, again, a preventive measure so that you don't deal with, first of all, death, certain death of patients, but also costs down the road that the government should incur for trying radiation, surgery, and so on and so forth, when it might not be as efficient as catching it early.
According to McKinsey and company, multinationals are flocking to take advantage of the opportunities, but long-term success is by no means assured. Although we remain optimistic about the overall outlook of China healthcare market, multinationals will find it harder and harder to compete, and they expect a clear separation between winners and laggards, mostly because of the local companies in China rising up to the occasion. I have one more question to the panelists, and then we'll open it for Q&A for everybody else. Where do you see, you kind of answered a little bit, but kind of, Linda Bai, maybe you can add that, where do you see the main opportunities for U.S. healthcare industry in this emerging growth market in China?
Yeah, in China, as I said, the America is a free pricing market for pharmaceutical product. But in China, the price is still controlled by the government. And in recent years, many provinces have the government tender, but in last year, in many provinces, some company from from America or Europe already give up the price because the price already control to benefit heart standard, right? So for some local product manufacturer of pharmaceutical products, they try to control the cost. But for the American company, I think if they go to China, maybe target the innovation pharmaceutical products is more profit and is easy to handle. And for the generic product, have a good partner in China and development the market together is a better choice, I think.
Eric?
As I said, I mean, as part of that nasopharyngeal carcinoma, I think I will know more as we venture into it. So it's just the beginning. Right now, there seems to be a very nice reception of the product in Hong Kong. But again, Hong Kong is a large metropolitan city with affluent people. Once you move to rural areas of Southeast Asia or southern China, we would like to see how it will be taken. The test is not cheap, but I think again this is another thing that I was going to discuss. Now the opportunity is here. As part of this preventive way of looking things, governments, United States government also, and the Chinese government certainly looking at high-tech tests. These tests don't come cheap. Right now, there's a trend from the United States government in cutting reimbursements to the laboratories for these kind of tests. There, for example, the pharmacogenomic testing or testing of tumor sequencing the tumor cells to tailor the chemotherapy to that specific person's tumor, basically personalized medicine. Although we had President Obama talking about personalized medicine in his last State of the Union speech, and bringing it up and putting a lot of money up to do that, but Centers for Medical CMS, basically, who's in charge of Medicare and the states, are trying to cut reimbursements. So they're not allowing payments for these type of tests, calling them right now investigational. I think at some point the governments need to come to the realization that if the tests are proven to be effective, they need to take this step and start doing the testing. For example, once you do a genome sequence of let's say, a newborn child, and you bear the cost of $1,500 for this person that is just born, throughout their life, their genome is not going to change. So they can use that information in their health file, and as a cost, that's a primary cost that you take, as opposed to multiple tests that would do the same thing in the future and will cost the system more, and it will take time from the patients. It will take time to do the testing and get the result back to the physician so that they can, prescribe the correct medication or take a certain procedure. Already from get-go, they'll be in their file and they can go in there and look at that result. So these are things that I think the government should realize and have a task force maybe to look into, that maybe a certain investment up front can help them in the future as far as cost cutting. Basically, like paying into an insurance fund, looking to see what comes down in the future. And same is true with the NP screen test, I think, going to China, and we'll see how the Chinese government will look at it as far as pricing and distributing it.
So basically, the key drivers of this amazing industry boom is government support, urbanization pressures, changing lifestyles, aging population, and increased awareness of and the need for quality care are the main drivers for this industry boom. And now I'll open for Q&A. Yes, please.
I would like to ask you for your view on effective strategies for direct marketing of medical services to consumers in China. And a closely related question is, how prevalent is health insurance that can be used in private clinics?
Well, I can tell you my experience in Hong Kong only, and that's the only thing that I can give you. The health insurance, basically, for our test, we cannot use it, and it's not there. So the money is coming, or basically the purchase of the kit is coming directly from the patients themselves. So basically as a cash pay. The way we did this thing, at least in Hong Kong, it was successful. It was by working with a marketing company, a Hong Kong-based marketing company, and also having collaborators at very well-known hospitals and healthcare centers. So through them, we demonstrated that this test actually saves lives. And once these people were convinced of that fact, then word of mouth is what happened. So physicians were more convinced. Actually, some of these physicians and our collaborators, Canadian collaborators, were actually invited to TV programs, had interviews with some newspapers. So that spread the word. And although it's not a very pleasant procedure, the collection of it, but I think it's as unpleasant as going through a pap smear for the ladies. So if it's a must, and if it is going to save lives for you, then people take this step. So that's how we were able to market it. It is pretty expensive, but right now it's the sales are going pretty nice and robust in Hong Kong.
Yes, next
So
one.
this question is for Ms. Bai. So does the Chinese government, and excuse me for my ignorance, but does the Chinese government allow HMO, it's like US, where you can choose certain healthcare providers, or no? That's my first question. Second question is the Chinese system a single payer system, like perhaps a UK system, maybe like the US in some 20 years or so? But if that's the case, what do you do to market there?
For the first question, in China, the government only covered the insurance for the local medical service, and almost is government hospitals. And now more and more private hospitals want to be included in the insurance system, but it's not easy. Only some of the very big scale hospitals have the right to be included in the insurance system in China. And also in different provinces, they have different insurance regulation. Something happened when you, if you lived in Shanghai, sorry, I get a little city. Maybe when you lived in some little city, something like the Suzhou, okay? Of course, Suzhou is not so little, right? In Suzhou, but you want to choose a best hospital in Shanghai or Beijing. So it's very hard. You get the insurance, back your money, because your insurance based in your city. But government already do some method to improve this condition, but still need time to put on. Yeah.
Yes.
I was wondering if I could get some perspectives on the mental health system in China and perceptions of the public to mental health. I guess in the news we hear about China having a fairly underdeveloped mental health system, and that being an area in need of a lot of development, whether it's through government or private enterprise. So I was keen to get some perspectives on that.
Sorry, I don't get very clear.
So he's asking about mental health, which is more kind of an area in healthcare, more specific, and he's wondering about how China government handles that as part of the healthcare program.
Yeah, but for the mental problem, I don't think we have a special insurance for that. Yeah, and if you mentioned something is like the spirit, so sorry, because I don't understand where mental different.
Yeah, it's a different area from what they're dealing with, but What I'm aware from the research I've done is that China is trying to offer universal healthcare. It's a challenge that all around the world, that are trying to duplicate something similar to what happens in Canada or Singapore has a universal health program. And so as part of it, I would not making an assumptions, but I would look probably it would be included in that, but it will probably be more on a pharmaceutical treatment. But other than that, we don't have an answer for that. Yes.
Yes.
Yeah. Yes.
I have a question for Eric.
Yeah.
So your company, are you marketing a machine, a testing machine, or you're marketing like a kit to the
No, it's actually a kit. It's a collection kit, and the samples come through via FedEx to United States, actually to our laboratory, and we run them here.
Oh, you're running here?
Yes, we do run the test here.
And then the payment comes from the patient?
Payment comes directly from the patient, yes.
It's still done remotely.
It's still done remotely, and again, this is a collaboration with the Canadian group, and the Canadian group has the marketing rights, and basically rights to the test. But we are the only laboratory. Since I developed the test, we're the only laboratory who runs it. So we have an exclusivity on running it. To be frank, I'm going to be very frank with you. And I've told and I've asked them to allow us to go there and establish a laboratory because it's going to be simple to run it there. But they're not confident about it, and they're worried about someone taking the test and running it on their own in China with no IP control or anything like that.
Do you have any ethical issues with your samples, these human samples coming to the United States?
No, we get samples from all over the world, from islands of Guam, Saipan, from Canada, we don't have any problems there. No. It's declared as a medical sample and it comes here. As long as you can vouch for and be careful of their contagious stuff. We're a medical laboratory, so we're able to get samples across the world.
And the technology is based on PCR, qPCR?
Yes, it is qPCRs.
So all laboratories are regulated in the U.S. so heavily that that's part of it.
That's
falls
part
under
of
that umbrella. Yeah. Yes. You had a
I was
question?
going to ask this by
Yeah.
In China, how is alternative medicine, such as acupuncture or herbal medicine, is that included? Is it covered by insurance? How is that treated? Being that it's a very prevalent form of use.
You mean the acupuncture, something like the traditional Chinese tradition, right? Yeah, sure. In China, the insurance also including the chemical products and the service, something TCM, traditional Chinese medicine, and also something like you said, the punctuation, something like the medical service. This is also included in the insurance. Yeah.
I will verify that it's true that the Chinese medicine and traditional is also included as part of the healthcare program. I've read that.
Yeah.
Yes. Yes. One last question. Sorry.
So you're talking about the service, medical laboratory service in China. How about the assay development in China?
Pardon me? How about what?
The clinical test development.
How about clinical test development in China?
Yeah.
If there's a need, if there's the opportunity, why not? We currently, our business model is not like that. We do everything in-house here. We do not outsource any work to any companies, even in the United States. So our needs have been, we have had outsourced some software work to China and to India, but that's as far as the actual clinical kits and the trials, no, we have not, that's not our business model here.
I want to use this opportunity to thank you for coming here today, for participating in this panel, and for the panelists, thank you very much.